When facing surgery, most people focus on their diagnosis, the hospital, and the procedure itself. But a groundbreaking new study suggests another detail could matter more than you think: the sex of your surgeon. In a massive population-based study from Canada, researchers examined outcomes from over 1.1 million surgeries performed between 2007 and 2019. They compared what happened to patients treated by female surgeons versus male surgeons, not just in the days after surgery, but over the long term, at 90 days and 1 year. And the results are striking. Patients treated by female surgeons had significantly better outcomes. That means fewer deaths, fewer hospital readmissions, and fewer major complications, even after adjusting for patient health, hospital characteristics, surgeon experience, and procedure type. Let's look at the numbers. At 1 year after surgery, 25.0% of patients treated by male surgeons experienced a serious adverse event, but only 20.7% of those treated by female surgeons did. The adjusted odds of dying within a year were 24% higher for patients treated by male surgeons, and the same pattern was seen at 90 days, where female surgeons' patients had lower mortality, fewer readmissions, and fewer complications. These findings held true across nearly all subgroups: elective and emergency surgeries, young and old patients, high and low-risk cases. In fact, the difference was most pronounced in female patients treated by male surgeons, where the risk of complications was even higher. So why might this be happening? The researchers suggest that differences in practice style and patient communication may be key. Prior research has shown that female physicians often spend more time with patients, are more likely to follow clinical guidelines, communicate more thoroughly, and focus more on collaborative decision-making. In surgery, these factors could translate into better pre-op preparation, fewer unnecessary procedures, and more attentive post-op care. But the study also raises tough questions. Why do women still face barriers in surgical careers, despite evidence that their patients often do better? And how can health systems learn from these findings to improve care across the board? The authors are clear. It's not about choosing a surgeon solely based on sex. Not every female surgeon delivers better care, and not every male surgeon delivers worse outcomes. But the consistent pattern suggests system-level lessons that can be learned from how women tend to practice. In the meantime, the study highlights the importance of diversifying the surgical workforce and supporting women in surgery, not just for equity, but for better patient outcomes. This isn't the first study to show female physicians may outperform in certain areas, but it is one of the first to show those differences extend beyond 30 days after surgery and into the long-term health of patients. For anyone facing surgery, it's worth asking, how does my surgeon communicate? Do I feel heard? Is there a collaborative plan? Because the quality of that relationship and the values behind it could make a bigger difference than we once thought.